In order to explain what treehouse is, I think it's best to go back and really talk about the way it was created. And by understanding how we came up with the program, we can sort of dive into what the modalities do and how they all work together collectively to produce what is treehouse recovery. So 6 years ago, when we decided to put this together, I put a team of people in the same room on and off for about 18 months. And our objective was to produce a program that would achieve results that were better than anything anybody had ever seen in the country to date. And I'm happy to say that we've accomplished that goal over the last 5 years. And so here's a little bit about how we did that. So we started really wide. We attacked this differently than what somebody would typically in a scenario looking at substance abuse. We looked at it just as a general problem. And what ended up happening is we kept going to a conversation about the state of the human condition. And where that led us to was looking at how human beings have evolved over time, say looking at it through a lens of about 50,000 years. And over the last 100 years, something really dramatic happened to our species that is really notable and something we took a deep look at. So what does that mean? Well, 100 years ago, when we started to create machines, we jumped off the evolutionary plane. What I mean by that is that human beings are genetically very similar to our ancestors. So everyone out there that's watching this, you have a genetic makeup that's very similar to your ancestors of, say, 500, 10,000 years and on back. But what's different is that our environment changed. Our environment changed so dramatically in the last 100 years that it would be completely ridiculous to assume that that hasn't had some sort of repercussion. Now, granted, it's been really good, but everything has its cost. So what changed? Well, there's two things that we've identified that changed. One, human beings stopped moving. So we no longer move or have the relationships with our bodies that we used to have prior to the Industrial Revolution. And the second thing that we see, and that this is a really hard one to debate, is that we stopped connecting. We were all raised to be independent. That's the American way, be independent. But what's happened with this over time is that we've lost our sense of community. And this is getting worse every day, and you can see it in the fact that so many Americans and so many people in the Western world are deeply lonely, and they're longing for connection. So we identified these two things. The physical movement, not using the body, and not being connected as two huge shifts that human beings have gone through since the Industrial Revolution. So then what we did with that is we basically came up with a hypothesis. We said, if we can get people moving to the same degree that they were pre-Industrial Revolution, and if we could get people connecting in a way before pre-Industrial Revolution as well, if we can somehow recreate that our theory was that most, if not all, of the issues with addiction would either lessen or go away. And so we took that information and we built a program based on that. And so what we did is we said, okay, how do we make a program where we get people deeply connected, get them physical, get them reconnected with their bodies, address all the clinical issues that are going on with them, and all of the things that have happened to their thinking as a result of these other conditions. And we created the Treehouse Recovery Treatment Program. And what that looks like is we've got two different departments. We have a physical empowerment department and we have a clinical department. Our physical empowerment department was designed and put together by a former U.S. Navy SEAL. And the clinical department was put together and basically created to look very similar to what most treatment centers would look like. Now, on the physical empowerment department side, the reason that we brought in a former U.S. Navy SEAL is because what we wanted to do was create the same level of synergy and team closeness and connectivity that we saw or see in the SEAL teams. Even if we could get like 1% of that, we felt like we would be doing our clients a huge service, or our patients a huge service. So we designed modalities that were intentionally created to bring the patients really close together, to get them reliant on each other, to get them working together all the time. Okay, so that manifested itself into a series of modalities that were created at Treehouse. Many of them use various forms of evidence-based treatment, but these different modalities act as platforms to accomplish our specific goals, both in the physical side and the clinical side. These modalities include action-based induction therapy, which is basically set up to get a client to learn to work well on teams and interact and connect with others, while simultaneously working out the part of the brain that's responsible for human connection, the part of the brain that goes dormant in active addiction, which is our prefrontal cortex. And then we have embodied presence, which is really designed to teach self-regulation, emotional regulation, and to redevelop a sense of the mind and the body connection. And then we have ESM therapy, which is really about getting the body back to that pre-industrial revolution state. So the idea is to train a person so that the body gets to a point where it's able to do a significant amount of work, that it is highly tuned so that it is strong and effective and working and firing on all cylinders. So that's on the physical side. And then on the clinical side, we've got traditional one-on-one sessions, we've got process group, and then we have a college-like class that is addiction education. And basically what that's going to do is teach our clients everything they need to know about the neurochemistry of addiction, the relapse prevention tools, and basically give each of our clients an education that is similar to what a counselor would have, an entry-level counselor would have, that's actually treating addiction. And then we have naked writing, or a writing therapy program. And what that is basically a series of structured writing assignments that are intended to really address trauma specifically with each client. And I guess what's important to note about this in terms of what the program looks like collectively is that all of these modalities come together in concert, and none of them are meant to be standalone individual components of the program. They are like various members of a symphony all playing together to write a song. And why does that matter? It matters because human beings are extremely complex, and addiction is extremely complex, and behavioral health is extremely complex. And you can't just address behavioral health by addressing behavior. You have to consider the fact that behavior is affected by neurology, it's affected by biology, it's affected by sociology, it's affected by all of these interdependent systems. And so a treatment program, any treatment program that is really, really effective at treating addiction or behavior in general, needs to be as sophisticated as a person. It needs to be as interconnected and interrelated as a human being is. And so really when we started, the idea was, how do we create a program that really kind of mirrors a human being? Like, it hits all of the basic components of a human being and is not, each modality is not separated, but each one has a level of interconnectedness that actually mirrors a human being's level of interconnectedness. For example, the way that we think, our psychology is affected by our neurochemistry. So modalities need to treat both the neurochemistry and the psychology at the same time. That's why we don't just put people in rooms and ask them to think their way through becoming happier. We understand that being happy has to do with chemistry, and it has to do with thought patterns. And so we've organized all of these things collectively to create kind of an overall, like, over-encompassing treatment approach that essentially treats all facets of a human being. And we've done it all under the pretense that human beings need this stuff, that our genetics are screaming for it, and that if we provide this food for our genetics, that what we end up having is people moving back to a very healthy, very balanced, basic state of being. And so that, in a nutshell, is what the Treehouse Recovery Program is.